So every fall, right? This is going to be released in early October. Every fall, people are just bombarded with ads and mailers. And look, in my corporate career, I've been the one sending them out. Maybe you have too.
Right.
But from your perspective, what actually matters when comparing plans and what's just noise?
So I think people need to look at the whole package of what's being offered. And so a lot of it is they fall into some very basic categories because there is a tendency to shop on the benefits, right? This plan has $2,000 of dental. My current plan has 1,000. Like, that must be twice as good. If 1,000 is good, 2,000 is twice as good. But you really have to look at the details around like what is actually covered. What is, is it just the cleanings that are covered, or is it going to cover your root canal? Another good example is what's the network. If your doctor is in the network, doesn't really matter what the copay is. If the hospital that's in the network isn't the hospital that you or your family would want to go to, like, does it really matter what the copay is when you go there if you don't want to be there, if you don't trust the healthcare that you're getting? And so I really think that the biggest thing is looking beneath the surface. And then, a lot of that is also around people oftentimes disregard drug coverage as something that's not that important, especially if they're not that on that many medications. But with all the new therapies coming out, all the new medications coming out, some of those things are on the formulary of your current plan. Some of them might not be. Is your pharmacy in the network? And so really it's about understanding your needs. And if you think that you need help with that, then you should probably ask for help.
Makes sense. So you talked about, products and cost benefit analysis, comparing and digging into the details. So what's the most common mistake you've seen people make when choosing a Medicare plan, and what usually causes it?
So I think it falls into a couple categories. One of them is not understanding of what's actually going on with their pharmacy program, particularly a formulary drug, because you can take the same medication with three different insurance companies, and you might have one company that covers it at no cost, another one that might have it at tier 3 for $47, and then the third one where it's not covered at all. And so, that could be a really big deal, particularly if you think about how people are using more and more medications these days. I think the second category is that people don't think about what's the most likely medical utilization that they're going to have. When people ask me for help and a little bit of advice, I talk to them a lot. Well, in the last 3, 4 years, like, what was the worst year that you had in terms of what happened with your health? And people will say, well, I had an operation 3 years ago. And well, were you in the hospital? Well, no, they did it outpatient. Oh, okay. And how many medications are you on? Well, I'm on these three, and well, they're all $0 with like all three companies that I'm considering. Well, how many times do you go to the doctor? Well, I go to one specialist. I go to the PCP 3 times a year. And so, like, you think about that, and it sounds like somebody has, maybe some health issues with all of those things that happen. But in reality, like, the actual out-of-pocket costs on most Medicare Advantage options that they would look at is minimal. And so a lot of times people say, well, I need the most expensive program. I need the program that has the biggest network. I need the program that has, the best coverage. And they're paying premium for things that they aren't going to use. Or conversely, they're, chasing after things that have low medical copays and giving up on some of those extra benefits that they could qualify for. Um, but, so it's really about understanding, like, what is actually most likely going to happen to you next year? And if things go worse than expected, like, how bad could it be? Because chances are, like, financially, it's not going to be that bad. And making a conscious decision to self-insure on a little bit of your potential healthcare needs versus spending money up front for things that have never happened before, I think is where people need to take the balance.
In that vein, do star ratings on Medicare Advantage plans really matter, or is it more marketing than meaning?
I would say it's more meaning than marketing, actually. There's quite a bit to it. Um, And, the interesting thing, and again, this kind of goes to a lot of what goes on underneath the surface with Medicare, is the stars rating are different measures that the federal government has chosen to designate as measures of quality. And you could think of it like on a very superficial level, simply as a good housekeeping seal of approval, but it's a little old school there, but it's actually a lot more than that. To some extent, it's the federal government manipulating the system to like push it in the direction that they want. But at the same time, like everything that's in there is real life healthcare. It's things that matter to you, and things that you're hopefully are thinking about. And if you're not, you ought to be. And so they really fall into some broader categories. One of those categories might be around screening measures. And so what percentage of people got their colonoscopy, percent of people got their mammogram, got their flu shot, whatever. And so think about how you can move the system by saying, well, we're going to measure insurance companies for flu shots, or we're not going to measure insurance companies for flu shots, because that's going to change like things that you then see from your insurance company. It's going to change things that you see from your pharmacy. Right now you might see pharmacies and companies like offering gift cards if you come and get your flu shot. Well, if the flu shot isn't part of stars, you're not going to see those gift cards anymore. There's some operational measures, things like how claims are handled, how quickly appeals are handled, how quickly the company answers the phone, whether you can get a foreign language line in an expedient fashion. And then some of the more interesting ones, and they were weighted really heavily a couple of years ago, but less so now, would be survey measures. And
Hmm.
so those fall into a couple categories. One of them is just a pure member survey. And so it'll ask you about, how do you feel about the quality of your insurance company? How do you feel about the quality of your physician? And surveys are really funny because, you catch me, grumpy, maybe you're going to get like a different survey outcome than if you catch me when I'm happy. And I think everybody is the same thing. And then there's other surveys where it's a longer term survey where the government surveys the same person over a period of time and asks them about changes of their physical and their mental health, and whether or not their physician is asking about their exercise program and everything else. And that's kind of a funny thing too, because how's your mental health, Matt? Is it better than it was 2 years ago? I don't know about mine. Like, I don't know that it's getting better, right? So it's just it's a funny thing to hold an insurance company responsible for, but it's also a good thing because, why does Medicare Advantage exist? It exists to make healthcare better for the Medicare beneficiaries in this country. If it's just collecting premium and offering services, like what's the real value? And so you might say, well, that's all good, and I care about my health, and I'm glad that the government is holding the companies responsible for that. What does that mean to me financially? And that's a big answer, actually, Matt, because the government then takes these scores and applies it to the funding that the companies receive. And I don't want to nerd out too much, but as you see companies move from 3 to 3.5, 4 to 4.5 stars, there's actually changes in some of the dynamics, some of the financing of the bidding that they do with the government. And so a higher star plan can have more value to put into their program and to grow their program. And conversely, a plan that has poor stars rating receives less money. The biggest threshold difference, and this is an important point, Matt, this is something else that people want to look at, especially on renewal, is that a health plan receives a 5% revenue bonus as they move from 3.5 to 4 stars. And there are some markets in this country where most of the plans are 4 or higher stars, where if you have 3.5 stars, you're not going to have a valuable enough product that people would want to buy it. And so, if a plan maybe slips to 3.5 stars for like 1 year, maybe they can ride that out. But if you see your plan being below 4 stars consistently, and there's other plans that are higher, you really ought to take a look at that, because it's only a matter of time before they have to scale back your benefits or scale back in some other way. And then the other thing that's interesting, and this goes back to the comment about it being a seal of approval, is if the stars, and there's not a lot of plans that fall into these two categories, but if the plan receives a very low score, than a 2.5 or lower score, they'll actually get a little warning symbol put on their plan on the CMS Plan Finder, kind of like a warning label on your plan. That's kind of a funny and scary thing.
Yeah,
And
I call
conversely,
that the flat tire indicator. It shows up on your
it looks a
dash.
lot like
That's what it
that, the
looks like.
little red
Yeah,
triangle, right?
yeah, yeah.
So it's and then on the other end of the spectrum, if you're a 5-star plan, you can actually enroll people year round. And so it not only do you get the bragging rights in your marketing to say, hey, 5-star plan, only 5-star plan in whatever, Southern California or whatever, but you also get to enroll people year round. And that's kind of a very special thing if you're in the marketing business.